Time is 11:24. A recent study finds mothers of babies born with a heart condition are more likely to be hospitalized later with their own heart condition. Joining us today to talk more about this is Dr. David Revere, a clinical cardiologist at Heart Hospital of Austin. Good morning to you.
Good morning.
So tell us a little bit about what this study found.
It's an interesting study. This was a study in Quebec, Canada, about a little over 1 million women, and it looked at pregnancies pretty much about 24 to 25 years out from the pregnancy, from the birth. Pretty long-term study. And over 1 million women followed, found that women who gave birth to children who had severe congenital cardiac defects, heart defects as a baby, they themselves were at increased risk of heart problems later in life.
And these findings are really significant because heart disease is the #1 killer of women, correct?
It is still the #1 killer of women. We've got a long way to go, and there is a big sort of push now in cardiology to recognize that and to work towards combating that.
Some of that is knowing your risk factors, knowing what what things play a role in that. Talk to me about those risk factors. What are they?
That's right. So, you know, in cardiology, every year the risk factors are growing more and more. We're looking at more and more things. There's the big five: smoking, high blood pressure, high cholesterol, family history, diabetes. This is really interesting because we're always looking back at the history, all these things in your parents, grandparents, but now we have to start asking, what about your children? And I think we don't routinely always ask that, but we need to start. And if somebody says, well, my grandfather had a heart attack, my father had a heart attack, but I also gave birth to a child that had a congenital defect, that's a woman that I think we need to look at differently than somebody who hasn't, and they may be at increased risk beyond just the traditional risk factors.
And if you are at an increased risk, what can you do preventative?
Yeah, so I mean, this goes back to a lot of the original things that we kind of apply to everyone. Smoking, don't smoke, don't drink excessively, try to exercise as much as you can, watch your diet, keep your weight down. But I think in women like this, you know, who may not have otherwise come onto our radar because they were seemingly healthy, I think we need to sort of maybe get them started earlier.
Yeah. When we talk about this study, it was done for women in Canada. Are there plans to further that research here in America?
Yeah, so one of the things with the study, there were limitations to the study, as there are with most studies, but I think this has really triggered a renewed interest for organizations like the American Heart Association and other you know, academic institutions to look further into this, because this is pretty important.
All right. Thank you so much for
You're
joining
welcome.
us this morning. We certainly appreciate it, and we will be
Anytime.
right back.